of 8 persons following the outbreak of a suspected Buruli ulcer in Malabo community of Fofure local government area. Commissioner for Health Felix Tanguane disclosed that samples from the affected patients have now been collected and sent to the National Reference Laboratory for further investigation. While awaiting confirmation, the state government says some of the patients are currently receiving treatment at the Modibo Adamawa University Teaching Hospital in Yola. Mr. Tanguane reassured citizens that the state government, in collaboration with the Federal Ministry of Health and Development partners, is taking proactive measures to contain the spread. He urged residents to remain calm but vigilant. As investigations continue, the Adamawa state government has promised to intensify community sensitization campaigns and strengthen collaboration with national and international partners in order to curb the spread of the disease.
We are suspecting Buruli ulcer. It's a bacterial infection that eats the flesh. It has been long. It is not known here. It's known in other parts of the country, far from here, and perhaps in other parts of the world. Report was received that there was such outbreak in Malabo area. Samples were taken and they were sent to the National Reference Laboratory. And I want to tell the public that the government is aware and the government has not been sleeping about it. We will still go back to Malabo to ascertain the level of quarantine or as to whether it is contained within that community or is spread into other communities.
TVC News' Jesse Daniel joins me live from Adamawa for more on this development. What more do we know about the suspected Buruli ulcer cases in Malabo community? How fast is the infection spreading, and are there fresh cases beyond the initial 8 deaths reported?
Yeah, at the moment, this is currently a health emergency in Adamawa State, and also the state authorities have confirmed that yes, indeed, we have a suspected case. It is a suspected case of Buruli ulcer. It has not yet been confirmed yet, even though authorities say that they are trying their best to ensure that they provide immediate care to affected victims of this suspected Buruli ulcer. When we earlier on spoke with government officials, as you heard in the earlier on report to the Commissioner for Health in Adamawa State, they said that they've already collected samples already, and they have presented the samples to the National Laboratory for further investigation. At the moment, it is something that is a bit worrisome because of how fast it is already spreading. At the point where we had the interview with the Commissioner, the 8 deaths were not confirmed, but later on we received this information that already 8 persons have been confirmed there from the Buruli ulcer that have been confirmed. So at the moment, every other thing that is being done is to be able to provide more like a first aid, more like a preliminary to be able to manage the cases because it has not yet been confirmed. But at the moment, as I tell you right now, the persons that have been affected with this particular illness are currently in pain. But thanks to the intervention of the state government, already patients are already receiving intervention at the Modibo Adamawa University Teaching Hospital. It will be interesting also to know that Fofure local government, this case is recorded in a community in the Fofure local government area. So at the moment right now, the Fofure local government area is at least not too far from Yola South local government, which is the state capital also. So at the moment, by tomorrow, going forward, when we receive the samples that have been taken for testing at the National Laboratory, we'll be able to ascertain what exactly is the root cause. But authorities at this point in time need to be able to tame the tide at this point in time to forestall further spread of this disease.
Precisely what are residents in Malabo and surrounding communities saying? How are they receiving this news?
Yeah, at the moment, everywhere is calm. Everywhere citizens are taking precautionary measures because this is not something that is airborne. Not yet, we don't know, but the communities everywhere, everybody is calm. Authorities are calling for calm. Sensitization is going on. Advocacy and campaign is going on. The primary healthcare are kind of their duties. The state epidemiologist department are working with other development partners in Adamawa. Ever since they received this particular case, the report of this case, all hands have been on deck to be able to ensure the further spreading of this disease in other communities within Adamawa. That is why at the moment, while they await the return of some of these samples, every health worker that is responsible have been deployed to that particular community as I speak to you right now to forestall any further. Because the way it actually happens, they said it begins with a boy, as little as a boy, and next thing it will mesmerize to the point that it begins to consume the skin, and it makes the patient to be in their pain. At this point in time, it is not only peculiar also to either adults or children from the preliminaries that we're hearing right now. But at the moment, it is going in a bit of rapid, but authorities say there's no cause for alarm at the moment because every suspected case that have been reported is already being treated at the Modibo Adama University Teaching Hospital and also primary healthcare facilities within Fofure local government area. All of this is being contained. So at the moment, what the state government and other development partners are doing is to continue making advocacy and also ensure that everybody stays safe.
Jesse Daniel live for us in Yola. Thank you for the updates there.